The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Jonathan with NutriDyn. How are you guys? Hey, we're very excited that you're joining us today to continue our discussion on the ketogenic diet and especially dealing with chronic conditions. As you know, we have Dr. Scott with us today, and he's going to really help us to identify chronic conditions and how this ketogenic diet can help that. But as we learn, keep thinking of ways and how we can implement this more into our clinics, into our settings, and to be able to help more people. As you know, this is number 2 of the list of 3 different webinars. The next one is going to be, or I should say, the last one is going to be in 2 weeks on August 7th, the final one there, and that's going to be using ketosis to boost sports performance. So we look forward to that. So just a little bit on this seminar that it's 30 minutes long, and we're going to have question and answer at the end. And if you want more information, especially learning how to implement this more, we have 2 events coming up in Sioux Falls on September 22nd and the 23rd in Des Moines, Iowa, where Dr. Scott will be there to really spend more time. But just to give you a little more information on Dr. Scott as we continue with this second webinar, he is the clinic director of chirokinetics. He's a chiropractor, board certified naturopath, and certified functional medicine practitioner in Walnut Creek, California. Dr. Bergman has been a nutritional consultant for Lunabar and for the Lunabar professional mountain bike and triathlon teams. And what's kind of interesting too, we talked about this at the last one, but when he was working with them and coaching the mountain bike team, they were actually number 1 in the world. So we know his passion, his experience, especially when it comes to sports in that way. He has worked privately with national and world champion triathletes, and Dr. Bergman is the functional medicine director for the NFL pre-combine strength and conditioning facility too. So for over 26 years, Dr. Bergman has been presenting health and nutrition and fitness information internationally, and he has been using the ketogenic diet in his practice for weight management, clinical issues such as autoimmune, endocrine, GI, mood disorders, learning and behavioral disorders as well. And so it's nice because when I spend time with Dr. Scott, you really realize his passion is with the ketogenic diet, and his knowledge is fantastic behind it. So when we really had talked to him in the beginning, we can see we really have somebody special here that has been using this, and to be able to really implement it into his clinic for a period of time. So when we hear him speak, it's something that we know we can take it home, and it's been used and been tried on, and he's seen success with it. So we're very excited to have Dr. Scott here today. Again, just so we know how this works, is that it's going to be 30 minutes of information. There'll be a question and answer at the end, and so everyone is muted just to keep the noise down. But if you have a question, type it in under the questions area over there, and then at the end, I'll relate them back to Scott, and then he'll be able to comment on them. So let's give our attention to Dr. Scott Bergman with his title on ketosis in chronic conditions. Dr. Scott.
Thank you. Thank you so much. Audio is coming in okay?
I'm hearing you great.
Perfect. Perfect. Thank you, everyone, for attending. I know everyone is very busy, and I have a lot of information that I would love to get through. So I'll jump right in. The way that I started with the ketogenic diet for my clinic was that I felt that I was working way too hard trying to regulate blood sugar. And for all of you listening, knowing the detriments of metabolic syndrome and insulin resistance and type 2 diabetes and all of the processed sugars in our diets and how that was creating inflammation and chronic degenerative diseases in our society, I just felt like dealing with the blood sugar was way too hard because we were already in an environment of glucose dysregulation, meaning to me, insulin resistance was the dragon and the blood sugar was the tail. And I just found myself constantly wrestling the tail of that beast and obviously losing. So I had to come up with something that worked a little bit better in my office for my patients, and that's what I'm hopefully going to be able to share with you guys. So the objectives today, we're going to talk about the low carb, high fat diet. I'll probably refer to it as the LCHF or the ketogenic diet. I might even say KD. We'll understand the mechanisms of the ketogenic approach, and then we'll discuss the clinical implications for insulin resistance, inflammation overall, maybe even tap into some hormone metabolism, gut health, and then brain and cognition, and maybe some of the emerging studies that are coming down the pipeline that maybe aren't too well established yet, but it's the direction of the research. So as Jonathan had mentioned, I'll be speaking in South Dakota and in Iowa, doing full day seminar on what I'm trying to condense down into the next 25 minutes or so. So bear with me, and then I'd be happy to take some questions. As a review from our first is an epidemic in our country, childhood obesity in the world, and what we're seeing is the prevalence of that obesity has been increasing over the last 60 years. And in those last 60 years, we've concluded that much of that has come from that food pyramid that we were taught back in the 70s. I think 1972 is when it came out, of high carbohydrates, grains, pastas, and what that has created is an enormous amount of cardiovascular disease, blood sugar issues, cognitive issues, joint pain, muscle pain, you name it. It seems quite coincidental that the moment that we switch to a high carbohydrate, low fat diet, we've had this rising epidemic. So some of the things that we've been looking at is the ketogenic diet. And just a quick review of the ketogenic diet. Ketones or ketone bodies are produced in the liver from fatty acids. And those ketones are able to pass through the cell into the mitochondria and used as a very, very efficient form of fuel. So I think it's easy to conclude that in ancient man, where food was not always plentiful, there had to be a mechanism in which we would use fat for fuel, rather than, if we didn't get to eat that day, we would start breaking down muscle tissue and get weaker and weaker and weaker. So I think it's easy to accept that we had to have a mechanism where we were very efficient fat burners. And right now in our society, we're just not. We are carbohydrate centric and dependent, I would say. So ketosis is allowing those blood ketones, those ketone bodies, to raise in the bloodstream to over 0.5 millimoles per liter. When we are over that level, and within, I think the green zone would be 0.5 to 3.0 ketone bodies. When we're there, we are in what we call a state of ketosis, where we are using ketones for energy rather than blood sugar, and rather than glycogen as well. The ketogenic diet is a very, very low carbohydrate diet. We try to keep the fat about 70% getting into ketosis. We want to keep the protein relatively adequate, but not super high, around 20%. And we try to keep the carbohydrates below 10% when we're trying to get into ketosis. Once we get into ketosis, we become what we call keto adapted. And that can take anywhere from a couple days to several months, depending on what is happening clinically with your patient. The more insulin resistant they are, the more hormone dysregulation they have, the more inflamed they are, the more stressed they are, the harder it is to get into ketosis and to allow every single cell in your body to be keto adapted. It could take a while. Most of the time, what I find is that the people who say the ketogenic diet hadn't worked for them, they just didn't give it enough time. So we have to wait for that metabolic shift to actually occur. One of the things that I want to point out is NutriDyn has a really nice ketogenic program guide. I don't know if they've released that yet, but it's a pamphlet that is real simple to hand to the patient. Very simple steps on how to get into ketosis, certain food do's and don'ts, and even some recommended supplementation. So something that if it's not out to the docs yet, NutriDyn will get that out soon. Hopefully, at least by when we have the lecture in South Dakota and Iowa. So I just wanted to mention that real quick. Here's the evolution of the ketogenic diets. If we look all the way on the left, where we are looking at one of the original treatments for epilepsy, and hopefully we'll be able to speak about why that occurred. They weren't sure exactly why, but there's more than one mechanism of why that happened. And then they started looking at how to get into ketosis a little bit more efficiently. There was some renewed interest in epilepsy once some of the emerging science on ketosis came out, and they said, oh yeah, we used to use that all the time. Yeah, let's go back to that. Now they're starting to look at research for cancer and cognition and Alzheimer's disease. And when we talk about sports, I'm going to be talking about the ketogenic diet for TBIs, traumatic brain injuries, and concussions. So over the last 80, 90 years, we have quite a bit of information on the ketogenic diet. This is not something new. When we're talking about energy utilization, I remind my patients that we are either utilizing energy or we are storing energy, meaning we're either burning or we are accumulating glycogen, and then therefore when that spills over, we are putting that into fat. So what is the major determinant is how metabolically flexible we are. And for me, the ketogenic diet is a tool. The tool is to change the metabolism so that they become metabolically flexible, so that they can have carbohydrates and use those carbohydrates for fuel. But for the most part, they are able to use the larger storage of fat. So metabolically flexible is the term that I use for my patients. They seem to get that, especially when we look at their blood sugar, their A1C, we look at their fasting insulin, we look at some of their other biomarkers and show them that they're definitely carbohydrate dependent and not flexible. Some of the ways that we should use our energy is our blood sugar is a pretty finite level. We only have somewhere between 4 to 5 grams of sugar in the blood at any one time. That's 1 teaspoon. Anything over that gets stored as glycogen, but glycogen is also finite. We can store about 1,600 calories in the muscle, depending on who you are and how much muscle mass you have, but also about 400 in the liver. So we kind of max out at 2,000 calories. Once we burn that, then we are able to tap into our fat source. 1,000 calories based on our body fat percentage. 35,000 calories is not a lot. A pro triathlete was tested. He had 6% body fat, and that 6% body fat turned out to be just around 10 pounds of body fat. Well, 3,500 calories in 1 pound. So someone with 6% body fat still has 35,000 calories of stored fat that can be used if we are metabolically flexible. So I think that's the big. However, what tends to occur is because of these higher carbohydrate diets, and as we discussed, blood sugar doesn't like to be higher than about 100, 150 before it starts shoving energy into glycogen. And then once glycogen is full, you must store that as fat. Or if we become insulin resistant, we will store that as fat and even bypass the glycogen. Sorry about that. So one of the things to think about, and what I discussed with my patients, is I used to tell them that insulin resistance was a blood sugar issue. We got to balance out the sugars. That's when I went to the ketogenic diet and I said, well, let's lower the amount of insulin. So then I thought it was an insulin issue. But is it really an insulin issue, or is it more of an insulin receptor issue? So if it becomes an insulin receptor issue, now you're talking about the health and well-being of the tissues themselves. And we get this receptor resistance cycle where the body has to store excess energy as fat. Now, once we have that, then we get all the adverse consequences of the body fat. We get the cardiovascular situations because of the inflammation. We get respiratory. We get musculoskeletal and the myalgias. We get the gastrointestinal issues because the inflammatory responses of that high sugar will break down the GI lining and create dysbiosis and allow for pathogens to proliferate, and then we have this endotoxemia that is created, all from the inflammatory processes of a high sugar, high carbohydrate diet. And then we also have our gender specific issues like the PCOS for women. I'm sure you guys have found this as well, but I have found every single time handling blood sugar issues for PCOS, every single time they get results. So moving them into the ketogenic diet seemed to help them even further with that. So some of the specific issues I want us to remember in the muscles, if our muscles are inflamed, then we reduce the body's ability to transport energy into the muscle cell. So this can be anything from an injury where it's a sprain strain. It could be overtraining syndrome for your athletes. And we'll talk a lot about that in our athletic webinar. But anytime there's systemic inflammation, it reduces the muscle's ability to absorb nutrients. That then becomes the source of the insulin resistance. So is insulin resistance an insulin issue and a receptor issue on the cell wall, or is it a disease process of the entire muscle itself? So now it becomes a condition of musculoskeletal inflammation. Anyway, silly things I think about. So I believe that being on the ketogenic diet, the studies have shown that it is, at least today, the most anti-inflammatory diet that we know of. So we can reduce inflammation, we can reduce oxidative stress, we can reduce endotoxemia with a ketogenic diet and reducing the inflammation and allowing that energy to actually get into the muscle tissue and the glycogen. With the HPA HPT axis for the adrenals and the thyroid, I am constantly seeing improvements with adrenal health, female and male hormone health, and for some reason, people think that the ketogenic diet is bad for the thyroid. I haven't found that. I haven't found that to be true, at least in my practice, and I welcome any questions about that. So one of the things that I want to present as a thought is the insulin is required for proper thyroid function, yes, and T3 can go down in a ketogenic diet. One of the thoughts that I would like to present is that clinically, to diagnose hypothyroidism, the clinical diagnosis is high TSH, low T4. What's missing in that conversation is it has nothing to do with T3. We can have lower T3 and not be hypothyroid. Now, I understand that we can have a lack of conversion from T4 to T3, and that can happen in the liver. I understand that we can have an upregulation of, right here, reverse T3 from T4 and reducing T3, but I haven't seen any literature that proves ketosis inhibits the conversion of T4 to T3. So blaming the ketogenic diet on lower T3, to me, is like blaming a vegetarian diet on high blood sugar, if that makes sense. Or we can move it back to the ketogenic diet. Blood sugar always goes down. So are we saying that the ketogenic diet produces hypoglycemia? I don't think so. I think we don't need as much blood sugar. So what I would present as a possibility or a hypothesis is it possible that T3 is reducing because the tissues have become more thyroid sensitive? Just like insulin sensitivity, can there be a thyroid sensitivity where, yes, T3 goes down, but that doesn't necessarily make them hypothyroid? Again, the clinical definition of hypothyroidism is high TSH, low T4. Somewhat on a snarkier comment, I'll go off on a tangent. I had a buddy of mine go skiing with me, and I brought a ski coach to come with us. And my buddy was saying, "I'm a great skier, I just can't do moguls." And this ski coach, who has coached some of the top World Cup skiers in the world, like Travis Ganong, he quickly said, "It's not that you're a good skier and you can't do moguls. You can't ski, and the moguls prove it." Now, that's a big tangent, but the reason what I'm saying is maybe it's not that the ketogenic diet caused the thyroid levels to go down and caused a thyroid issue. Is it possible that you already had a thyroid issue and that the transition of going from a carb-dependent situation to metabolically flexible and trying to get keto adapted brought the thyroid issue to the surface. And certainly you got to handle the thyroid issue, but it's just something that, as a hypothesis, maybe we could accept that. Also, with the ketogenic diet, we're looking at gene expression, histone deacetylase. The ketogenic diet has been shown to allow the deacetylation, the unraveling of the DNA to allow for gene expression to be expressed. So that's a big deal. We're looking at epigenetic issues with the ketogenic diet. Moving into the gut issues with the ketogenic diet, one of the things that I have seen is that the ketogenic diet has a very high level of antioxidants. The beta hydroxybutyrate is also anti-pathogenic. And the ketogenic diet has a lot of MCTs, the medium chain triglycerides, which happens to be great for candida. So what they're seeing is that the ketogenic diet, by second generation, because it's so anti-inflammatory, it's allowing, number one, it's killing off some of the bad pathogens and the bad bacteria in the gut, but it's allowing our good bacteria to thrive. And with the ketogenic diet, if done right, like anything, like any other diet, if you do it right, you are getting the right amount of fiber, and you are increasing the prebiotics, increasing your short chain fatty acids, which has been proven to help repair leaky gut, and has been shown to help with cognitive conditions as well, with the increase of the short chain fatty acids. So the gut issues improve with the ketogenic diet as well. Looking at the gut-brain axis, or the MGB, the microbiome gut-brain axis, when the gut is healthy, we then send messages through the vagus nerve directly to the brain, because the vagus nerve is a cranial nerve. The vagus nerve, or it's referred to as the wandering nerve, has direct hard wires from the brain to the gut that are both efferent and afferent. So messages are able to go across from the brain to the gut and the gut to the brain directly through the vagus nerve. So the health and well-being of the gut with the ketogenic diet has been shown to have a direct benefit to brain health. So on this slide, I'm just showing that the MGB axis regulates the gastric intestinal function and the energy homeostasis, which, because you're getting possibly more anti-inflammatory messages to the brain, you're calming down the HPA axis. You're regulating neurotransmitter pathways, and you're upregulating growth factors like BDNF, brain-derived neurotropic factors, to actually regenerate the axons in the brain. So healing the gut will also help heal the brain. With Alzheimer's disease, they're definitely seeing benefits with the ketogenic diet, and there's specific insults from the brain, and this whole Alzheimer's cognitive topic alone can take a couple hours. I presented at the University of Miami's ICAMP, the International Conference for Alternative Medicine, on cognitive health. And believe me, it takes several hours. But what we're seeing is that the ketogenic diet upregulating some of these growth factors can actually reduce some of the amyloid plaques in the brain. And the issue with the ketogenic diet versus a sugar diet, we know that the more sugar that we're getting in, the more plaquing that can be created in the brain. And that's why we'll see in a later slide, Alzheimer's is seen as a type 3 diabetes. So the sugar gets in the brain, the brain becomes insulin resistant. There's extra sugar that kind of glycates, it's kind of like caramelizing. So you get these plaques of sugars in the brain. So one of the things that we want to remember is that although the brain is pretty small and only takes up about 2% of our body mass, it will take up about a quarter of our energy. So we need to make sure that we're constantly feeding the brain. The hippocampus is the area associated with learning and memory, and studies have shown that the more complex the task, the less sugar is in the hippocampus of the brain. So we know that the hippocampus needs fuel for high learning, executive learning issues. So we also know that when we are healthy and young, we could use glucose almost 100% for the brain. As we naturally age, though, we lose about 10 to 15% of the ability to take in glucose. 10 to 15% of nourishing the brain, I think, is big enough. And then what they found for Alzheimer's is it could be up to a 35% deficit of using sugar for the brain. But what they also found was in the elderly, the brain was able to uptake ketones without any reduction. So even as they got older, they were still able to use ketones for fuel. And what they're seeing is that the brain can use up to about 70%. So 70% of the calories required, about 350 calories, can be from ketones. The ketones can pass the blood-brain barrier, even when it's inflamed. So again, as a little bit of a teaser, I see concussions and Alzheimer's very similar in the nutritional requirements. When we have a concussion, that blood-brain barrier, the effusion, the ability for things to pass through the blood-brain barrier is reduced. So sugar doesn't get to the brain, so the brain can't be fueled. The same thing happens with our geriatric patients. As people are getting older or as they are having this type 3 diabetes, the sugar can't get into the brain, but the ketones can. They are small enough to pass through even when there is inflammation or plaquing. So what we're seeing is that the ketogenic diet is good for more than just some memory. We're seeing the ketogenic diet for anxiety and depression, and I think I would go back to the gut-brain axis for that, where they are showing that the healthier the gut is, the less anxiety, depression, the less ADD, ADHD, and autism symptoms there are for people suffering with that. So they're seeing the healing of the gut, the reduction of inflammation on the ketogenic diet, ketones getting to the brain, and afferent messages from the gut to the brain, allowing the HPA and the HPT axis to regulate. Even reaction, motivation, and impulses. So people on the ketogenic diet are seen to be sharper, and it will not completely erase, but we can actually stop the learning and the memory issues from getting worse, and there has been improvement. So, in summary, one of the things that we're looking at with keto adaptation is being able to see ketones as a source of fuel for the brain and for the muscle and for the liver. We know that it is glycogen sparing. We know that the beta hydroxybutyrate, the BHB, will also improve cell signaling, like the histone deacetylase inhibition. We will be able to use fat as fuel, and we know that we've got almost an infinite source of fat that we can use, even if we're at 6% body fat. We also have seen that it is a cleaner fuel to burn. There's not as much oxidative stress that we see with the higher carbohydrate diets. It improves insulin sensitivity. Again, I don't have any research on this, but I have seen that people's thyroids improve, not get worse. So I'm even looking at improved receptor sensitivity overall. And I'll just repeat what Jonathan was speaking about. We have the sports performance in the ketogenic diet coming in a couple weeks on August 7th. And as well on September 22nd, I will be in Sioux Falls, South Dakota, and on the 23rd in Des Moines, Iowa. And we'll have a full day seminar revolving around inflammation, everything from musculoskeletal conditions all the way to cognitive issues, and how I use the ketogenic diet as a tool, and then move back and forth into intermittent fasting, low carb, high fat diets. We'll put that all together, and hopefully that would be something that you guys see valuable and you would enjoy. And I'll just throw this out there again. I think this is a really cool little pamphlet that NutriDyn and Jonathan spearheaded, something real easy for patients to take home, and it's got a real nice do's and don'ts list of what to eat and what not to eat. And most of the time I find that that's what patients need the most. I'm not a big fan of writing out diets for them every single day because it becomes almost too restrictive. I like my patients to try and make their own meals and have successes and have failures, and allow us to discuss that, because once they make a mistake, they know not to make that mistake again. So this is a great little program guide. That's all I have for you guys today. I'd be happy to answer some questions, and thank you so much for being here and being interested. I appreciate being able to talk about what I love to talk about.
Thank you, Dr. Scott. I appreciate your time. And as I know, chatting with you earlier, it's very difficult, you were mentioning, to really take all this information down and to kind of get it in 30 minutes. And so I just want to tell you, I appreciate you taking your time and doing that so it's digestible. But really, you're going to be able to spend the time, coming up in September. So we hope everyone that has found this of interest and really want to learn how to implement this better, to look forward to see Dr. Scott coming up in Iowa and South Dakota. So I want to thank everyone. I'm looking at the questions, and I don't see any listed. And so I think, Dr. Scott, you're going to have an easy day.
Okay.
Yeah. So you'll be able to go relax now. No. Yeah, if anything pop up, I'll share with you. But otherwise, this if you'd like to hear this again, we're going to make this recording available. And then just to let everybody know, if you would like to sign up for that, for the next one, or for the seminar itself, when it comes to Iowa and South Dakota, you can actually go to NutriDyn.com and to be able to click on the education tab, and there you can sign up for the seminar coming up. And if you want to reach out to your rep, we'll get you the link to get to the webinar. So thanks again for everybody tuning in. Thank you, Dr. Scott. We appreciate your time, and we look forward to seeing everyone very soon.
Yeah, thanks so much.
All right, everyone. Have a good afternoon.